everybody. I know we did mention this, but I am going to reiterate it. Today, we are in discussion with Dr. Jayanthy from Tamira Plastic Surgery, a wellness and aesthetic clinic. Definitely needs no introduction. Being in Chennai, I think this is a name. Tamira is a name I've heard on multiple occasions, and not through ads, not through the television, but directly from people I know who've had a wonderful experience at your center. So having you here today, Doctor, being in conversation with you, it's an absolute pleasure of mine. So once again, very warm welcome. Thank you for being here with us.
Thank you so much, Santana. I'm really humbled by the introduction you gave me. So I am a plastic surgeon, have been dedicated my practice exclusively to aesthetic work. So this session is not to do an advertisement or anything, because I sincerely wish that the aesthetic industry grows and expands. And in India, like in many other countries like US, Europe, Brazil, etc. We see a lot of patients having fillers from non-trained professionals, and and are not aware of what are the after effects or what to look forward, and so on and so forth. So I'm really happy to be joining you, and it's great to have someone like you who knows the media well, so that this message is taken across to many who will be interested, or who would consider this, if not now, at later in their life.
Yes. Okay. So, doctor, let's start out. We are talking about Botox and derma fillers, and from a personal standpoint, being an influencer myself, I get so many inquiries from other skin clinics to, come get a filler done. And there's, like you mentioned, you don't know whether you're going to a trained professional. You want to make sure that you go to somebody who is definitely going to be taking care of you. And I've had some bad experiences, not around Botox, but around other, skin issues I've treated at certain centers, which has scared me even further. So let's start out. And if you could tell us, what exactly is derma fillers, and how is it different from Botox? Okay. I think two different things, if I'm right. Correct me. Yes, go on.
Sure. So two quick fix solutions to make your skin or remove certain or to make your skin clear, or I would say anti-aging, or better, are derma fillers and Botox. So these are two quick fix injections. So they both are injections. And when we say as injections, Botox is botulinum toxin. You have toxin A, and you have different forms. Botox is a brand. People, because the brand became so popular, everybody calls it as Botox, but Botox is a brand name. So you have different brand name for botulinum toxin, and Botox is one of the brand names. So that's a brand name. Dermal filler is the it's a terminology, medical terminology used to put any substance into your skin, right? Okay. Meaning that you have hyaluronic acid and you have non-hyaluronic acid fillers. Filler is a gel-like substance available in pre-filled syringes, and it could be of different chemical composition. Commonly used ones are hyaluronic acid, but you can have many other semi-permanent. You have hydroxyapatite, and you have different chemical combination which goes inside. So it's something like a gel, which is either when you put inside stays as a gel, or it can convert into something more solid, or it can give rise to some reaction which can helps you to either enhance or lift or correct certain deformities, or certain contour irregularities in the face. So basically, they both are different. So fillers are gel-like substances available in pre-filled syringes. Botox is a liquid injection which comes like a crystal powdered crystal, and to which we add some saline or non-preservative saline and convert it into a clear liquid. And we, based on the reason why we are injecting, we choose the amount that is required and we inject them. Now, basically, they do different function. Botox actually removes what we call dynamic wrinkles in the wherever they are put in. Dynamic means it appears when we animate, not static, right? So if you when we smile, when like the lines that we that we get around the eyes, the lines that we get around the nose, in the forehead, when you look up, when you animate, so that is botulinum toxin, right? Botox is the brand name. Now, filler is where you want some enhancement. You want a high cheekbone. You want some, little filling in your cheeks. Some people have flatness in this temporal area. It looks too sunken and hollow. You want to fill them. Some people want to contour the nose. You have some irregularities. You have a depression on the nose. So you want to just quickly, give a straight line on the nose. So it's a filler. It's a gel substance which is applied. And they come with different consistency and different molecular size. So if you, let's say, I would like to have a high cheekbone and my cheekbone is flat. So you're trying to enhance the cheekbone. So you need a more solid filler which can mimic a bone, right? It should not get flattened by the cheek up. So then we choose a little thicker molecule. Similarly, you want little enhancement for your lips. Your lips are flat. You don't want such thick molecules. So then you want to add a little thinner molecule. So all these are fillers. And yes, for wrinkles, fillers can also be used, but those are static wrinkles, meaning even without animation, you have some lines that are permanent. Some people have these two lines on the forehead. Some people have horizontal lines here. Some people have these angle of the mouth drooping down. So few of them are concerned about when you're young, you have this nasolabial. This is a nose and this is a lid. So the nasolabial folds being more prominent. So anywhere you fill, it's like, imagine there is a hole and you put some mud to fill that to make it level. So fillers are substances like that.
Doctor, I don't think anyone could have explained this much better. But I want to pick up on one point. You cannot deny the fact that today there's a lot of taboo that surrounds this. Even people who go, I have friends who are models who go get Botox or fillers done, and they still don't want to talk about it. But then again, you did mention about the fact that people come to you because they have certain irregularities. Like, growing up, I've been very conscious about certain things within my body. And I think Botox is something that can definitely, help people get over that kind of consciousness that they have, that self-consciousness. Oh, what do people think about my nose? Or, maybe they've been made fun of their nose while growing up. Have you get people coming to you for these purposes, and has Botox and derma fillers been able to help people kind of get over their insecurities, and maybe not just insecurities, but different reasons along these lines?
Absolutely, Sandana. See, I'll tell you, we are changing, but we have not changed completely. Our society is very judgmental, right? See, I always tell a story. About 10 years ago, I was in Brazil for a workshop, where the workshop is for breast implant, right? So there was a company called Silimed, and they had invited for a workshop, and I was there. So, I have to travel. I have to get certain words translated in Portuguese because not everybody can speak English. So I go to the front office desk and, I asked a few sentences to write and give it to me so that I can show the cab chauffeur or whatever it is. Then she asked me, where are you from and why are you here? So when I said I have come for a Silimed workshop, she just casually told me, Doctor, my boobs are from Silimed, right? So today we live in a society, like you said, people are not, open to say I had a Botox or I had an injection, because there's still a myth that these are vanity procedures. And if you take them, it's going to create some problem in your body. And so you don't want to reveal it. But
Yes.
actually, it is not so. These procedures are done to enhance certain aging phenomena that normally happens and to reverse them. So these are medically approved. It is not something hush hush and you're doing it without anybody. They are medically approved procedures. And all of these fillers, they go through FDA, they are tested, and it is quite safe. And of course, any company which comes out with these fillers, they train the practitioners who inject them. And of course, you need a lot of experience to put them correct. And I will not say that, the after effects or the complications does never arises out of this. I always say, like, if you go to a experienced and a trained person, the chance of complication is very minuscule. And if it comes, they know to handle it for you, right? It may be rare, but doesn't mean they don't come. And it's not common. If it's going to come, cause life-threatening complication or anything, I don't, the medical council will not approve these procedures, right? In the West, you have even nurses, the Botox nurses, they're trained to give these injection. Exactly, they're taught the anatomy, and so just people just go and get it done, right? They're not so much of, and people don't mind saying, I had a Botox. So what? It's just Botox, right? So, but we live in a judgmental society. People think, okay, because you are in the media, you need this. Or okay, if you're not a non-media person, you don't need these procedures. It isn't like that. Aging is a phenomena which is common to everybody, right? So if given an option, everybody wants to look beautiful, be at their best. And when you're at your best, it gives you a lot of confidence to come forward in front of any meeting. Today, we are all doing most of the interactions virtually. And obviously, when we're looking at your face from the other side, you want it to be a little pleasant. When you look at it, certain things are not very prominent. It's okay to get them corrected, right? So that's okay. So that is why
it goes down to personal choice.
Absolutely.
Do I want to do it? As long as you're not forcing someone into doing something like this. If it's a personal choice, I think it's absolutely fine.
Absolutely.
Yeah. Now, I do notice that we have a lot of male viewers also who are part of this live. And is this something that's that is done by a lot of men? Do you have a lot of male clients?
Absolutely. See, men are, they have this habit of chewing gums. So there is a muscle here called masseter. So masseter is, if you're from your cheekbone here, it comes down to the jaws, lower jaws, right? Your upper jaw and your lower jaw. So you have a muscle here. So if you clench your teeth, you feel this muscle here. That is called a masseter muscle. And for men, when this masseter is very thick, right, they don't have this hollowing or the Millensomen side of a look where they don't get that cut. And so many of them come and get that softened. So we do give Botox for softening your masseter muscle. And of course, men have very strong folds between their eyebrows and around the crow's feet. So the procedure is same for both of them. The dose is little higher for men because they have stronger muscles compared to women.
Understandable. Now, I know, like you mentioned earlier, needles are involved. And I'm kind of a little scared of it. Is it painful, this procedure?
Yeah. So when we apply Botox, because it is liquid, you can use very, very fine needle, which is like a mosquito bite. I wouldn't say that you don't feel anything, but yes, it's like a small mosquito bite, right? So I am not too much discomfort, and we can apply with very thin needle. And the fillers are they also see, normally when you go and give blood, right? The needles that we use are much smaller than those needles. So that's one thing, be it for filler or for Botox. But filler needles are a little bigger than the Botox needles because a gel has to pass through that. And so, and it's very much tolerable. And of course, the pain factor also depends on the experience, right? Right. If you go, you have to keep, you don't do multiple injection with the same needle, because a blunt needle, when you try to poke in, will cause more pain. A sharper needle gives better results. So keep changing the needles, use the appropriate needle, and so on and so forth.
I think this is also one of the main reasons why you should be going to Even if it means spending an extra few hundreds, you might as well go to somebody who knows what they're doing. Rather than, because I like I mentioned before, you know, this is something I can relate to. I've seen people go try and get their, you know, nose, like you said, reshaped, jawlines, and I'm talking about men. Okay. And you know how in the gay community, I have a lot of friends who are gay, and the gay community looks are very predominantly, like, it's a main thing right now. So it's become a trend. And I've had people have bad experiences. So I think this is another reason for everyone watching. I think if you do opt for Botox or derma fillers, make sure you go to somebody who you can trust and who's very well known for this, because you don't want it to go downhill, right? Yes, go on.
Sanjana, one small thing when you say this, what I would like to mention is all our viewers should understand it's okay to underfill, right? I see people with just so much of fillers taken. You know, people come and tell me I've taken, like, you know, 6 fillers, 7 fillers. See, I like to go slow. So you're adding a gel to the skin or your under your skin, right? If you want, you can add more, but there's no point adding more and then trying to dissolve by putting a high lace. It's a waste of money, right? So I normally tell my clients, if somebody, like, it's especially somebody, let's say for the first time they're doing their lip, right, over, and they're very excited and you know how they lick. When you give injections, sometimes there'll be little swelling from the injection point, and all these hyaluronic acid also absorbs water. And the next day you have a little more swelling, and each person's skin is different. Like some people, when we travel, right, we have little bloating of the face for a couple of days. Some people it may not happen. So that's basically our soft tissues, how they react to certain things. So obviously when we put in fillers, it absorbs and it can cause a lot of you know, swelling, and then immediately they are worried. So you know, they have some imaginary result in their mind. And then when they go out of the clinic, they feel it's okay. When they go home next day morning, they see a lot of things. They are completely, so it's my advice to anybody is to go slow. If you're trying out, get comfortable with the procedures. Try one session. Look if you're comfortable with the physician and if you're comfortable with the result, and then go ahead. Don't put too many, based on all the advertisements, everything, too many injections, and then come back and say, you know, after like I get patients coming after 1 month, somewhere they've taken a filler and they're asking me to high lace it. Because after some time, that fillers is a gel, right? It gets into the tissue space. Only the physician who puts the filler actually might know where exactly they put it. But even if it is the same person, it gets into multiple planes. And then you may not able to identify exactly, because it's a blind procedure, right? Once inside, you know, you're not keeping some camera or a scanner to find out where it is and then lysing it. So then we may not get exactly lyse all the gel. So it's better to go a bit slow.
Thank you, doctor. Now, before we could move on to the next that I have for you, for everyone who's joined this live, though we're talking about Botox and derma fillers, if you've got any questions or skin concerns, please do feel free to drop a comment below, and I'm sure doctor will be more than happy to go ahead and answer that for you. Now, doctor, you did mention that, you know, don't go overboard, try and take it slow. Now, if I was to go and get a filler done, or say Botox, talk about both, I've heard people say that, oh, you know what, I don't want to do it because if I do it once, I have to keep doing it to maintain it, you know, and once the effects start wearing out, it will kind of, say for example, you're fixing wrinkles. Once the effect of the filler wears out, it will wrinkle even more. I've heard all these different, you know, statements. How far is this true? And, you know, what is your take on it? Is it something we have to keep maintaining? And will it affect us double once the effects wear off of the fillers?
Okay, so that's a nice question, Santana. So I think all our viewers who are, should know this, and as well people who are regularly using Botox and fillers. Now, first, it's important to understand why do we get wrinkles, right? So these muscles in the face, they have attachment to the skin, right? Maybe because of weight loss and we're trying to diet and the skin laxity, skin becomes more lax, and these muscles, they lose the tone, but whatever reason, right? Poor nutrition. Then as they keep pulling the skin, the wrinkles develop, right? It's like crushing a paper. Imagine you have a plain paper and you keep crushing it and you spread the paper again. You still have those marks, right? So that's how it is there. Now imagine you keep that paper straight for some time. Are those marks going to be less visible or more visible? So when you actually put Botox, the chance of you developing more wrinkle actually reduces.
Okay, that's very interesting. I've never thought along those lines.
Yeah, and another important point is when you put Botox, it is a substance which completely removes or its effect goes off in about 4 to 6 months, depending on the dose and depending on the muscle. So let's say the muscle has something called neuromuscular junction. So we're trying to inactivate them, right? So depending on the dose, how many of those junctions are inactivated? Less number inactivated, the effects may be settled down and it comes off faster. More inactivated, effects last longer and it comes little slowly, right? So it doesn't become more. In fact, you're reducing the number of wrinkles that comes, but you will get back to where you were before. It won't reverse, right? So these procedures don't reverse anything.
Yes. Okay, I understand.
But at the same time, it will prevent progression. So if you have a wedding or you have a function, it's okay to put it once and then forget about it after the effect goes off. It's not must you have to maintain.
To keep maintaining it. Okay, I understand.
Absolutely not. Absolutely not. People keep repeating this because they like the effort and the effect of the procedure and the end result of it. Let's say you take a filler for the lips and you're very happy with it. And so after some time when the effect goes off, it's not because it's looking bad that you want it. Now it's because you want it like how it was with the filler, you're doing it again.
Okay, understandable. Yes. Thank you, doctor, for that. Now, I know some people, okay, fine. Now we are all working from home. Everyone's looking at the computers non-stop, sleepless nights. I can relate to that myself. And I've been developing a lot of, dark circles. Like it's been becoming more and more dark. I've noticed that. And concealers are not doing the job that they should. So my question is there any procedure under the bracket of Botox or derma filler that can kind of help fight or kind of reduce the darkness that we have under our eyes?
Yeah, so Botox is not the right solution to reduce dark circles, Santana, because, excuse me, the reason why we get dark circles is there are 4 reasons. One, it could be because of a loose skin under eye. Let's say, with aging, weight loss, your elastin and collagen in the skin gets disintegrated and the skin becomes loose. So ideally, if somebody, let's say you have dark circle, you hold your skin here and just try to pull it up and see if those darkness goes away. Then it's purely because of lax skin, right? So then you either remove that lax skin or you try to tighten it. Removing is done surgically through a procedure called blepharoplasty. Tightening is done. It can be done over a period of time, 6 months, 1 year, 2 years by using cream. Otherwise, you can do some procedures for tightening. You have microneedling, you have fractional radio frequency. You have different brands, like Thermage is one brand which uses fractional radio frequency and it was FDA approved. This is only if they have a lax skin. The same dark circle can be because somebody has lost volume, the fat under their eyes, right? Because of, again, weight loss, or it's the continuous movement of the periocular muscle, right? You let's say you take some weights and you do exercise multiple repetition. You develop your biceps. You try and lose all the fat around it. Similar here, continuous movement of your periocular muscle. So the fat atrophy. That fat atrophy, there is loss of volume. So when the volume is lost, you have to put back the volume, right? We can't selectively eat substance to go and put fat only around the eyes. It's not possible. So then what we do is we try and put filler. So when you put filler, yeah.
Come into play.
Yes, that is why derma fillers come into place. You're adding volume. But if it is excess skin, only derma fillers may not help.
Okay. So
and some people also have this darkness because of pigmentary issues.
Yes.
Then the cream plays a vital role.
Okay.
So you need to identify why they have. That's why if you see someone, when we see that more than one factor is contributing to the darkness, we give them derma fillers. We tell them also to use, but then they feel when you put the derma filler, all of it is going to get corrected. It doesn't get corrected, right?
Sometimes it's a combination of different things that you have to try out.
Absolutely.
Okay. Doctor, would you mind sharing what the cost for the derma filler for dark circles?
Sure. So normally I use brands like Juvederm. You have different brands, Restylane. These are brands which are FDA approved and time tested. So I don't try and experiment with too many new brands because it's going into the skin. I try and choose which are so the prices vary with the brand. Today we have many fillers coming in from China, Korea, which can be even for 10,000, 5,000 rupees. You have fillers. So it's important the client understands which filler the physician is actually injecting. And if you ask there, when it comes from a company like Juvederm, it comes with an MRP. It cannot change, right? So the cost, maybe when you buy, someone who's doing more fillers can get a little discount on when they buy in bulk, when the physician purchases. So that discount could be passed on to the patient because of it. So there is a price of the filler and there is a price of the physician who's injecting the filler. So it can start anywhere. If you, let's say, a brand like Juvederm, the MRP is around 20,000 rupees with then the fees of the physician. So the fees of the physician, depending on the experience, they may charge a couple of thousand, they may charge 10,000. I know physicians who are great at it who can charge even 25,000. So that's their skill.
Which
right?
they want
Every profession. Yes, because they're so precise at it. Yes. They're so precise that they charge. So there is a cost for the filler and there is a cost for the physician who's injecting it, right? Similar for Botox. What we do is, in fact, when in a center in Tamira plastic surgery, we combine it, and for Botox, we give it per unit, right? Let's say if they're taking, I am okay for somebody to take even 10 units, 5 units. So when you take less number of units, let's say we charge around 350 rupees or 400 rupees per unit. When the requirement is more, we try and reduce the cost because they're taking more. When we dilute one full bottle, we are using it for them. Then we reduce it to around 250, even 300 rupees because we are giving more units. Right? The client also should understand, because you can't dilute and keep it for any number of days. When you dilute a 50 unit Botox, it has to be used within next 3 days, maximum effect. So obviously when we dilute for shorter, for less, what do I say, for 10 units or 15 units, and if there is a next client, we don't get another client filling within the next 2 days, we basically have to throw away the remaining Botox. So that is why a little price difference when you take less units and more units.
Okay. Now,
so
doctor,
the filler cost, it can range anywhere from 20,000 to even 50,000, depending on the filler. So you have now, the in thing is a filler called Profilo. It's and you have a similar one in Juvederm is called Volite. They're all done for skin enhancing, skin hydration, rejuvenation. It's a hyaluronic acid that you put glow, tightness, everything. So it's for Profilo, it's 2 treatment. So those injections are a little more expensive. The purchase cost is a little more expensive. And so the cost will be around 35,000. So depending on the filler, the cost will vary.
Very. Okay, understandable. Now, we've been talking quite a bit about the face. I'm curious to know, is Botox and derma fillers, are they only for the facial and neck area, or can they be used for other areas of the body? And if so, for what reason? Just to get...
Yeah, so let me tell you, Botox for aesthetic it came in much later than use of Botox for medical reasons. Okay. Right? For example, someone has a facial nerve and they get paralysis. So the one side of the face doesn't move at all, while the other side animates and pulls everything. Now, to balance that, Botox was used. Oh, okay. Similarly, you have children who have paralysis because of long-term spasticity, tight muscles, and because of which they have pain, like kids with cerebral palsy and all. So all of these conditions, Botox is used. Oh, okay. Similarly, for excessive sweating in the palms and sole, we call them hyperhidrosis.
I think even for underarms also, I
absolutely there, because the sweating is under autonomic nervous system, and those neuromuscular junctions can be blocked. Botox can be given.
That's nice. And how long would you have to keep doing that procedure? Is it like something like, say, for example, laser, right? If we have 8 sittings, then the hair growth is...
Botox, I told you, Santana, they don't reverse the process. So anything you do with Botox and fillers, it is the repetition as long as you want it, the effect.
Okay,
it doesn't turn. So, but for some areas, like for example, when you put for Basita, because you're not using, let's say like you don't walk for 5 years, right? For somebody has a paralysis, we call muscle atrophy, disuse muscle atrophy, because the muscle is not used for walking, it atrophies or it shrinks. It becomes looser stone. Similarly, by paralyzing it by putting Botox, it becomes atrophied. So over a period of time, you may not require it. It becomes softened.
Oh, okay.
So that is an advantage in some area. But otherwise, people do put the fillers for breast, buttocks. I'm sure you would have read a recent news where a mother and daughter were going house to house and injecting silicone for buttocks augmentation. I don't know if people can Google and see. And then one such patient actually embolized, meaning embolism means the silicone particle went through her blood vessel and blocked the major artery for the heart, and actually she died. So this kind of practice is also there, but I don't do them because they are not approved procedures. So like I told you, medically approved is different from medically not approved procedures. So those are not medically approved. It is done, but it's not approved.
And that's
like you were talking about the LGBT population, where they want a breast enhancement, and they're going around putting fillers. Even some known people just put it, but it's not safe, Santana. Putting so much volume is not medically approved.
No, that it is very scary. And see, that's the thing. There is this demand, not just in the LGBT community. General, now there's this growing demand to look or be a certain way, and sometimes some people can't afford it, so they resort to cheaper methods, like say for example, like how a lady and a daughter, and it's so scary because you're putting your health at risk. So I think this is exactly why you should be going to a trained physician, a trained doctor who's got that experience and knows what they are doing. So thank you, doctor, for clarifying that. And I think that's really important. Also, nowadays, I think there is this conscious movement towards, being vegan, using vegan products, be it makeup or the cosmetic creams you use. Is Botox and are derma fillers vegan in a way? Are they vegan brands available?
Honestly speaking, Sanjana, I really, I'll have to go back and see. There is no vegetarian. They are not no animal hyaluronic acid preparation. It's not that it's an hyaluronic acid. Now it's synthetically prepared. But whether the process involves any in between use of an animal, I am not aware of it. But I don't think there is any component of in the creams, of course. Like for example, when you take collagen, there is marine protein, so obviously the protein is taken from some marine source, so it's such that. But I don't think in Botox and fillers it is any of that. But botulinum toxin, like how it is prepared, sometimes, right, you have some of these antibiotics which are prepared from some yeast. They are prepared, right? So I am not, to be honest, to answer that the entire process, if there's any animal substance that is involved, I am not very sure. Maybe the next section I will clarify that. We'll go a little more into detail and tell you that, because it involves multiple process, right? To tell you that it should not involve in any of the process, not the actual chemical.
No, that's very true. No, I that thought just crossed my mind, because again, like I was saying, be it me or just friends who I have who are models, right now they've taken that conscious step towards, even if it's lipstick that we're using, is it animal tested? But again, like you said, it's a huge process manufacturing
Right.
that one particular product, and going and checking and seeing if at any step they've used or tested it on animals or used protein. It is difficult to kind of mention it, but thank you.
For example, you may not take it orally, right? People intake is different. Like we also apply antibiotic ointment and those things, right? So we still don't know whether, when normally the chemicals are not, it doesn't come under vegetarian, non-vegetarian or vegan. It doesn't say. But the gel, most of the time when a medicine is given through a gel, right? The capsule is made from animal gelatin.
Oh.
So that is why they put a green dot there to say that if that is not involving animal gelatin.
I understand. Okay.
So we don't have that in Botox or filler. So I've never noticed that, because these are substances which doesn't involve any of those animal products. But in the process, see, you're saying whether they tested, not tested, all that I don't know.
Yes. No, very true.
Every batch need to be tested. So that I'm not aware of.
But hopefully in the future, maybe we will have some clarity.
Sure, I will look up to that and then I'll give you an answer for that.
Okay, moving on, doctor. Now, I think they say that, your neck and your hands kind of show aging fastest, and wrinkles form at your neck pretty fast. Is derma filler a solution? Is it a safe area to be doing this? Or if not derma filler, is Botox the way to go? Can you shine
Yeah.
on that?
So that's also a good question, Santanas. But it also depends on for whom it is done for anti-aging for the neck. Let's say today I did a neck lift for one of my favorite patients. I've done multiple procedures for her. She's 76 years young, right? So if you look into my 50th year anniversary, in fact, she had spoken about how she feels. You will not guess her age unless I tell you that. You will say maybe 55 or so. Okay. Now, with extreme skin laxity, Botox or fillers may not give you a nice sculpted neck, right? But with now the neck, aging in the neck is one, loose skin, and there is a muscle under the skin called platysma, which when you pout your lip, let's say we pout, we get these bands. These bands are because of those muscle called platysmal folds. Now to inactivate them, Botox can be given. Okay. When you have loose skin, because permanently the skin is sitting in a place, it forms wrinkles, right? But when you form wrinkles, it's because there is a fold of skin and wrinkles. Those lines can be filled with fillers, but that doesn't even eventually smoothen out. But today, like I mentioned, the injection called Profilo, right? So Profilo is giving great results when you put on the skin, right? Because it's helping to form more collagen and elastin, gives hydration, and thereby helps to tighten your skin. So some dermal fillers like Profilo are very good for reducing the wrinkles in the skin. But otherwise, Static wrinkles, you put fillers, and for these dynamic bands that comes, we put Botox. Similar for the hand. So if you have a wrinkled skin, you need more hydration and you need volume, then you do add fillers. Botox will only remove some superficial. So I think we'll have to address some of the questions here.
Yeah.
One of my patients said, Sri Chandana, hi, good to see you here. So she had done Cosmil and pre. When I will take fillers in the face, how many days I need gap? So this Cosmil and peel is basically done to expose. Cosmil and peel is actually done to exfoliate, brighten your skin, remove the tan, and give you a smooth, glowing skin because of cell turnover. The process takes about 3 to 4 weeks to achieve that. I would suggest that the best time is to wait for that 3 to 4 weeks, and so that you know exactly the end result, and then we can decide on fillers of where do we need it, why do we need it, and then decide on which fillers might help. That's the answer that I would like. Good to see you here, Sri Chandana. And I had another patient who, I mean, not my patient, one, I think maybe
If
your friend.
For a minute,
Yeah.
I can't see any questions for some reason. So I think for everyone from the Tamira page, if they are sending in a comment, only you're able to see it. So
Oh, I'm sorry. I'm sorry. Okay. So I'll just quickly go through these questions because we've been having questions. So they've been here patiently. So we need to address them. Somebody was asking about nose fillers. So yes, the fillers are done to augment your dorsum, right? You want a sharp dorsum, there's any break in your dorsum, or you have a small hump here, you can mask that by putting a filler. And it's a quick injection, 10-15 minutes. I just use a cannula, meaning it's a blunt end so that it doesn't poke into any of the blood vessel while going in. I don't use a needle, so we just make a small nick with the needle and put a cannula and then fill the nose. It's a quick 10-15 minutes procedures, doesn't have any side effects, and you can do it. Next, somebody was asking about black spots in the face. What is the procedures? So we will have to evaluate and see whether the black spots is because of accumulation of it's a we call nevus, or sometimes skin tags, or just spots. So all spots, pigments come because your cell turnover is not uniform. So we have the whole face, skin is made up of cells. They all turn over, meaning there is 5 layers of cells and they turn over. If they are in the same age, right, then they just reflect the light. Then your skin will glow. But some are, you have a keratin which is not reflecting. Some, has scars, then the reflection, some absorb light, some transparent, some translucent. Then you don't get the glow. So it's important to make your cell turnover uniform, right? So that was another question that I saw. And then any advice or practice for tightening, like massages or like multani meti naturally? Now, Jirina, hi, good to see you here. Jirina, if you ask me, I don't know the chemical composition of multani meti. Because it was not taught in my medical curriculum. I don't know how it acts, whether it is inducing collagen. There is no, unless I have some literature papers, I will not be able to comment on that. But yes, there are enough procedures to tighten. So the skin gets tightened when the collagen elastin. So when you build your house, you're putting bricks and then you're putting cement, right? Cement holds the bricks. Your cells in the skin are like the bricks, and the cement is what we call ground matrix. So when you tighten that cement is of great quality, the cells are all held together, your skin tightens. That is why I said hyaluronic acid, the Profilo injection, actually with aging, with weight loss, with all our, photo aging, exposure to sunlight, the amount of hyaluronic acid in this ground matrix comes down. Elastin, collagen disintegrates, and that is why we lose luster in our skin. And so you use either the creams or you do procedures to improve this, which can be dermal fillers, it can be fractionated radio frequency tightening, or creams, good quality creams. Definitely they all will help you to tighten them, right? So Multani Metti, I'm not aware what's the chemical composition, but I will look up for you. Join us in our next session, and I will see if I can find any paper on what's the chemical composition and how it can help. Right. So other question I've answered, and then someone says which we had a branch in US. I'm not sure who this is. Tiago, we have an online pharmacy, Tiago. I am sad. Yes, we can't do procedures, but I can consult you over video and advise you, and we can recommend procedures which you can take there, because most of this is done by trained nurses there. And of course, if there's any products we can ship from here, we do online pharmacy, and that can be done. Then we have Jaren. What is the cost of Cosmil and Peel at Tamira? I think we charge around 35,000 plus tax, and that's one time. It's done multiple. It's not done multiple times. One time, and all your uneven skin tone texture. It's called a resurfacing fill, and it gives a great result, right? And then the other questions. Yeah, so I think that's about it. Yes, Santana, now we are okay.
Fortunately, I couldn't read the questions out for you, but you took over.
So the next session, I'll figure out how we can do that, Jarina, right? Santana, yeah.
I think we have another couple of minutes more. So this is definitely something I really wanted to ask you, which is acne, right? A lot of us, I have friends who have cystic acne. So how does Botox or derma fillers work on people with really acne prone skin? First, can you do it on such skin? Secondly, can it help reduce acne? Are these is there a procedure along these lines that can help fight acne and just clear your skin out?
Yeah, so as far as fillers are concerned, there are no derma fillers which can help you to handle active acne or the acute phase of acne. Mm-hmm. Derma fillers are used in patients or in clients who have scars from acne, right? So release those scars, and we do fat grafting as a permanent solution, and as a temporary solution, you can use derma fillers, right? Active acne, we cannot use derma fillers. Botox, yes, some physicians do what is called a micro Botox. They dilute the Botox and then apply it on the skin. Now, it has to be done very carefully, because if it diffuses into the muscle, then your smile gets altered and things like that. But only when you put on this skin, it reduces the activity of this. See, we get acne because of the hyperactivity of the oil secreting glands, right? So it does reduce the activity of the oil secreting glands. People do put Botox for scars as well, right? So I worked with one of the leading plastic surgeon in Singapore, Dr. Waffles Wu, and he taught me to use Botox for any scars, like after a breast augmentation or a small. He just put some Botox, and he has his own publication. He's done published a paper and he's written a chapter on the book how it can also help in these scars. Right. So similarly, when we do it, so the micro Botox techniques, I learned it from him. So it's just given on the skin, and that helps you because it's going to remove all these small wrinkles. So the skin glows, and that helps to reduce hyperactivity. But that's not the standard procedure. Acne is because of hyperactivity of the oil secreting glands. And why does the oily secreting glands become hyperactive? Is your lifestyle, sleeping late at night, not doing exercise, not drinking enough water, unhealthy creams on the skin, unhealthy diet. So these are the main reason. You correct all of them, definitely the activity of the oil secreting glands is going to come down. When you come to us, help you achieve there, we do advise lifestyle modification, but we also give you some medications, tablets to quickly bring down the activity. So yes, Botox and fillers are used in acne, but for different reason. Fillers are for scars and Botox is for the active phase, but I'm not for all active acne. You need to first, if there's an infection, pustule, you need to treat them before you do these procedures.
Awesome. Thank you. Thank you for that clarification, doctor. Do we have time for one last question before?
Yes. I'll also quickly scroll up and see if I missed any of the questions. From in the beginning, someone was asking me some question. I think next time we should ask them to post it in your handle as well.
Yes. Or comments or likes only from people from my handle. So from Tamira, I think only you're able to view it. That's the little goof up that we.
Someone wanted to know, will ice water face wash tighten the pores? Yes, it will tighten the pores. So it's not that pores are visible. When you see the pores and it's not open, pores are always open for everybody. The visibility is more, right? So yes, when you put ice, it helps to vasoconstrict the vessel, and then after that, that's a vasodilatation. So new blood comes in, and it does help to reduce the waterlogging in the skin, and will help to tighten the pores. So washing with ice water is a good idea to reduce pores. And then quick, any more questions? I think we're done. So I'll go with your questions, Santana. Is there any question?
Go on, doctor.
So again, same black mark center. Will laser be somewhere? Jaren, hi Jaren. So what can I do? Black mark on center of my nose. Oh, that's a good question. So people, you see a lot of blackheads on the nose, and many of them think that is blackheads. Sometimes it is the visibility of the hair, because oil secreting, if you go and Google and see the anatomy of the pilosebaceous unit, we call it, or your hair follicle, the oil secreting glands opens into the hair follicle. So when you see these black dots here, it can be blackheads, but that's because when it's clogged by the pores. But the other reason is there's a hair follicle right inside there, which you see. So then we combine a hair removal laser along with laser to remove those blackheads. So then that actually gives a better results. You understand? So there is some, most of the time people say, I'm doing a lot of extraction, but I still see these black dots. Yeah. So that black dots is because there is a hair follicle inside that you're actually seeing. So you need to do a hair removal laser there when actually those black dots go away, right? So yes, laser will be useful, right? So I think I'm done. Santana, you wanted to ask me some question. One last question. Let's finish that.
Just to follow up on you talking about the ice water wash, right? I've seen these TikTok videos and viral videos where people are directly putting ice cubes on the skin, and they're saying, wake up in the morning and just rub ice cubes on your skin and all your pores close up and your skin is glowing. But also contrary to that, I've seen articles where they say that you shouldn't do that because your blood vessels underneath your skin burst. What in this is true, and what is that limit that we need to maintain when it comes to ice?
Yeah, so my advice is take a bowl of water, put some ice cubes into it. So the water is at a temperature lower than your skin, right? So then use that for washing. So when the temperature is lower, it causes what we call vasoconstriction, right? That is called in many areas, right? Those days, if you have a bump, they say use hot water sponges, right? These days, if you go and ask them, they'll say use cold water sponges, right? Earlier days when people had fever, we told them to put ice cold sponges and take off the right. Today, we have shifted from that. We just say normal temperature water. Just put that to, so that there is a transmission of temperature from one side to the other. So here you're using something which is lower temperature than your fish, so that there is a vasoconstriction to some little, and then once you open up this, then it comes back. Your normal body temperature brings back the fresh blood vessels. They open up. This removes the toxins from the skins, and that will help you to remove all these clogged pores, and your pores get the visibility of the pores your ducts gets tightened and your pores visibility becomes reduced. So it's not taking ice cubes and putting onto your face. It's using a water temperature which is cooler than your normal facial temperature to wash.
Wonderful, wonderful. Thank you, Doctor. I think we had 1 hour of so much information, and I'm taking away so much from it, and a very interactive session. To everyone who's joined us here today, thank you so much. Please be sure to follow Tamira Life on Instagram. It's TAMIRALIFE. And this was Dr. Jayanthy with me. Thank you so much, Doctor. I'm sure this is very informative, and I will be seeing you soon at the clinic. You can count on.
Thank you so much, Santana. And I'll also like to mention to all our viewers, we have our YouTube channel. So I like to do educational videos, or I do videos on whatever questions somebody wants me to answer them on. We are happy to do. We're trying to spread information so that everybody is aware of the procedures. We remove this taboo about it's okay to get these aesthetic procedures. Do it from a trained professional. Be aware of what you're getting into, and know the cost. Know, you do your background, and the more information you know, I'm sure it'll be good. So we have our YouTube channel as well, and they can post the questions and we'll try to address all of them. Right?
Wonderful,
Thank you
wonderful.
so much, Santana.